Good morning, everybody. I'm Sayukta from All About Skin Wellbeing team, and I'm sure all of you must be keeping good health. We all know taking good care of our skin is important for more than just our appearance. As the largest organ, our skin becomes the most essential to our overall health. A fungal infection is a very common on our skin or nails, and fungal infections or mycosis are diseases caused by a fungus, yeast, or mold. Mild fungal skin infections can look like a rash, which can be really itchy and annoying. So let's connect today with our skin expert, Dr. Arti Bhasme, live from Pune, to enlighten us on the topic of fungal infection. Dr. Arti is a senior dermatologist and cosmetologist with an MBBS from Grant Medical College of Mumbai and post-graduation in dermatology from BJ Medical College, Ahmedabad, Gujarat. She is currently practicing at Dr. Bhasme's Diabetes and Skin Clinic. She has previously worked with Kaya Skin Clinic, Koregaon Park, and is associated with Sahyadri, IMAX, MediPoint, and Rising Medicare Hospital. And today we'll talk on fungal infection. A very warm welcome to you, Dr. Arti Bhasme.
Thank you so much.
Doctor, today we are going to talk about fungal infections and specifically in this season, when monsoons are here, in almost all parts of India, it's raining and people do encounter a lot of cases of fungal infection. So first of all, we would like to understand what is fungal infection, which are the areas in our body which are, more prone to fungal infection.
Good morning, everyone. I'm Dr. Arti Bhasme. Today, I'll be telling you about fungal infection. More of will be speaking about the superficial fungal infection, which are very common, and we see this such cases in our daily OPD, routine OPD. As India is a hot and humid climate, India has hot and humid climate. Fungal infections are very common nowadays. The cases are also increasing because of global warming. The overall climate is warmer, and because of changing in clothing patterns also, and because of increasing population also. Also, people have been misusing the drugs. People are not taking proper treatment, because of which fungal resistance is increasing, and so the number of cases are increasing. So see, fungal infection, basically now today we'll be speaking about the superficial fungal infection. Fungal infection can affect your skin area, skin, it can affect your nails also. In skin areas, particularly the areas of where the body folds are there. The body folds hold more of moisture and they are warm also. So like the groin area, the underarm area, in females below breast area, these areas can be affected due to fungal infection. Now, who can get fungal infection? Anybody can get fungal infection, but who are overweight, people who are pre-diabetic or diabetic at the risk of diabetes, definitely have more chance of getting fungal infection. Aged people above the age of 60, those who have little bit lower immunity. In general, people having less immunity because of other health diseases can also get fungal infection form. But nowadays we are seeing fungal infection also in younger individuals also. People are staying together in small places. If they are not following good proper hygiene, if they are sharing their towels, their clothes, then in that cases, these people can get fungal infection. Now, how does fungal infection look? See, it's difficult to define. Like if somebody asks me, how do you diagnose? So we diagnose by clinical examination. To a layman, it may just feel, it's a ring. People call it ringworm. In Hindi, they call it dad. In Marathi, we call it gachkarna or naita. These are the common names which they have. Patients also suspect, no, doctor, I have some fungal infection, but please check. So generally, it's a circular rash, but always not. Okay, it can affect, as I said, the folds area. It can start as small circular rash, but it keeps on increasing in size. It is slightly itchy, erythematous to start with. As the duration increases, the spread may also increase. It is a spreadable disease. So people living with you, if you are not following good hygiene, you can spread to your family members also. Okay.
Right. Now, what happens, doctor, in our society, especially because we have easy access to over the counter medication, whenever we see any kind of infection, be it fungal or any other, we'll immediately go to our chemist shop, ask for an over the counter medication. We don't know what it is, what's the composition. It could be a combination, tube, etc. But we'll keep on applying it. Many a times we apply topical steroids, not even knowing that what we are applying. And initially, because it works really as a wonder cream, we think that we have find a solution to it. But only later on, when the problem becomes out of control, goes out of control, is when we go and consult a qualified dermat like you, and that's when we get to know that we have already delayed the whole thing or made the whole thing even more worse. Now, my question to you, doctor, is that how okay is it to go for an over-the-counter medication or to go for combination creams or topical, creams?
See, applying over-the-counter medication is a strictly no. In India, there are no proper rules about which medication should be just given as OTC preparations. So, because of that, people take any creams from the medical representatives or from the chemist, local shop, they try it. But they are strictly no. Basically, there are combinations available in the market. So they are like combinations of 4 or 5 medications. They have an antifungal, they have an antibiotic, they have a steroid. So steroids basically are magical drugs. When the patient applies the creams, initial inflammation is gone because of steroid. The itching disappears and the skin appears better. So patient definitely finds relief and they feel, oh, this cream is treating me. But actually, what the steroids do, they reduce the local immunity. Because of the decrease in local immunity, you may feel initially the fungal infection has improved, but actually it spreads. It spreads at a double rate. So the steroid preparations which people are using from buying from the chemist are actually helping in spread of the infections. And people using this OTC preparations for longer duration see the side effects, other side effects of steroid creams. Basically, if you apply steroid creams for longer duration, they may cause thinning of the skin, causing stretch marks, striae. They can cause irritation in the later part. Initially, definitely you may feel, patient may feel the itching is gone down, irritation is gone down. But later, as the skin thins out, the skin becomes sensitive and may get irritated easily on sun exposure. Patient may develop itching on stopping the drug, so they get dependent on that medications also. Patient may if the patient applies the creams on the face, they may experience increased hair growth, which is called as hypertrichosis. So there are different side effects of this steroid creams, because of which definitely we tell the patients to avoid such OTC drugs. Patient coming to us after applying such creams develop generally resistant cases of fungal infection, because over the time, if just the fungus is suppressed, not treated properly, the fungus develops resistance. So such cases are difficult to treat. That is why, like previously, 10 years back, we could treat fungal infection in just 15 days or 20 days medication. But nowadays, because we are getting resistant cases, the duration of treatment required is more. And the dose of medication, the type of medication required is also at a higher dose.
Right. So it's always advisable to go and contact a qualified doctor, a qualified dermat at the very first place. That's really recommendable. Now, doctor, the thing is, we always say, especially in medical sector, that prevention is always better than cure. Given we have this hot and humid, conditions in almost all parts of our country right now, what are the preventive measures we can take?
See, as I previously told, fungal infection basically affects the moist and warm areas. So basically, like generally, this problem is more in starts in summer, can extend till uh, monsoon season also. It worsens in such situation. Patient has to, the most important thing to follow is good personal hygiene. They have to wear cotton breathable fabrics. They have to take shower daily. They should at least twice daily. If possible, it should be twice daily. If patient goes for a workout or something, they go to common areas like gym. Post after coming from there, they should change their clothes. They should take a shower. Avoid sharing personal items like combs, towels, hand towels. Bed sheets, avoid sharing beds. So, because when we exchange such daily personal hygiene products, the risk of transmitting infection is more. You have to keep your body dry. If somebody is sweating a lot, there are some absorbent powders that they can use to keep the area dry. And the main take home is like keep personal hygiene. That is the most important thing.
And with what you just said, I can make out that it's contagious. From one person, the others can also get it. Now, especially in a family, because if someone is infected by fungal infection, what the other family members can do to avoid getting it.
Generally, whenever a patient of fungal infection comes to me, I always ask for history of infection in other members. Many a times people are not aware whether their partner is affected or not. So I repeatedly, tell them to you should go home and check whether anybody has it, because many a times they are in denial. Nothing is there, only I am affected. So we ask them to check at home. And yes, if nobody is there still, we have to, tell the patient herself or himself that you have to follow good personal hygiene. You should avoid, as I said previously, avoid sharing your personal items with other people. Other people, for prevention, again, they have to keep following good hygiene. They can use absorbent powders, antifungal dusting powders, or antifungal soaps, and washing their clothes in hot water. The patient who is affected, we tell them to wash their clothes in hot water. Just adding some antiseptics won't help in case of fungal infection. Washing the clothes in hot water helps a lot. The clothes should be properly dried. If in such humid environment like in monsoon, if the clothes are not getting dried properly, you should iron your clothes from inside. This is very important to take care of the excess moisture which is there and which will transmit the infection to other people.
Right. We have also seen cases of recurrence in fungal infection. One who gets it for the first time is more prone of getting it again and again. What's the reason behind that, and what to do, doctor, in case of so?
See, the causes of recurrence are like, as I previously said, people who are more prone are obese patients or pre-diabetic, diabetic patients or elderly patients. So in those patients, we can get a recurrence. Many a times, cause of recurrence is basically resistant to treatment, as I previously discussed.
Mhm.
Patients apply over-the-counter medication. So in those patients, there are resistant cases which may require longer duration of treatment. But many a times patients don't follow the complete treatment plan. After getting relief, like once we start the medication, after 15, 20 days only, patient feels initial relief. So even after, telling them, educating them that more treatment is required, they may have to, come for 2 or 3 months minimally. Patients leave the treatment. So this is the most common reason of recurrence. Basically, the infection has not completely cured. Before that only they stop the treatment and then they come back with recurrence after 2 to 3 months. Also, if some other family member or any friend, relative is affected, but you are not aware and you are sharing the your space with them, you are at risk of getting fungal infection. So these things they have to keep in their mind.
Okay, so the bottom line is A, you need to go and consult a qualified dermat in case of any infection, specifically fungal infection. B, you need to trust your doctor and follow the prescription. That's very important. Keep the doctor in loop. Now, doctor, we would also like you to shed some light over nail fungal infection and fungal infection of scalp as well.
See, nail fungal infection is also a kind of superficial fungal infection, but it takes longer duration. Like the body skin infection may get treated in a matter of 2 to 3 months. Nail fungal infection takes longer duration of treatment. It like for fingernails, the treatment may go on for 3 to 6 months, and for toenails, the treatment may go on for a year also. Again, nail fungal infection is more common in elderly patient or diabetic patient or those people who have their hands in water for longer time, like housewives or people indulging in washing clothes or something. So those people are at get risk of fungal infection of the nail more common.
Okay. And talking about scalp fungal infection, many times we feel that, it's dandruff. And because again, in our society, we have this tendency of applying a lot of oil on our scalps, especially if we get to see anything which looks like, dry skin or something, we'll apply even more oil, keep it for longer. So is it okay to do practice, or what would you suggest in case we have dandruff, which could be a fungal infection?
See, basically, there are two types of fungal infection in the scalp. There is one fungal infection called as tinea capitis, which is more common in children. So in those cases, in few cases, the children may have hair loss also. In few cases, there is no hair loss. For them, the treatment line is completely different. And yes, definitely they have to consult a good qualified dermatologist at an earlier phase only so that the hair loss is avoided. Otherwise, it can lead to scarring and permanent hair loss sometimes may happen in those cases. And in adults, what we come across as fungal infection, these are different cases, like they appear as dandruff kind of thing. Patient many a times they just try with some OTC shampoos to get rid of that dandruff, but it just doesn't go or it tends to come back. So definitely for that, they need to consult the right doctor for it. Applying oil can worsen such kind of dandruff or fungal infection because yes, in India we advocate for applying more oil to keep the hair soft and supple. But those who are getting affected with dandruff should avoid over oiling, or in some cases they have to stop applying oil completely because the oil, especially like we apply coconut oil, so that oil, if it's there on the scalp for a longer duration, it actually facilitates the growth of the fungus. Frequent washing of the scalp, keeping it clear, dirt free, helps in keeping the fungal infection at a low level. Sometimes just shampoos don't help. We have to give some topical medicated lotions, and we may have to give some oral medications also for the fungal infection of scalp.
Fair enough. We'll quickly go through some of the questions that have been asked by our viewers. So we have Ajit Singh. His question is there a way I can prevent getting ringworm on my feet frequently?
See, ringworm on the feet is common in people who are wearing socks and shoes for longer duration. So in some work, people have to wear safety shoes and thick socks for longer duration. For those people, prevention is like basically you have to wear clean socks every day. Ensure that the socks are washed every day before putting on the socks to keep the feet dry. You have to apply uh, antifungal powders. There are absorbent powders which are available, which we can prescribe to the patient. Apply those powders so that the feet remain dry. And your shoes also, you need to clean them from inside. Once a week, you need to let them sun dry because there is a lot of moisture buildup inside the shoes also. So you can keep it in the sun, or there are some silica absorbent pads are available which can absorb the excess sweat or excess moisture from inside the shoes. Keep your feet clean. Examine your feet regularly to see any risk in any signs of fungal infection. Basically, in the feet, there could be cracks also. There could be the fungal infection of the nails also. So they have to examine their feet, and any abnormality is seen, they have to consult a dermatologist right away.
Okay. We have Akanksha Puri. Her question is, can oral antifungal drugs be taken during pregnancy?
See, basically in pregnancy and even in lactation period, we try to avoid oral medication as far as possible, especially in the first trimester, that is the first 3 months of pregnancy. We generally avoid giving oral medications. So it depends on the severity of disease. We try to treat it by topical creams and just topical dusting powders and soap. But in few cases, if it's very strong, if the fungal infection is very severe, so it can be treated. There are certain drugs which are category B drugs. Category B drugs are like drugs which are safe in pregnancy. So those drugs, with the advice of the dermatologist and also after consulting your gynecologist, can be given if the fungal infection is too severe. Because if the fungal infection is not rightly treated in pregnancy, after delivery, the there is a risk of transmission to the newborn baby. And to the newborn baby, again, we cannot give any oral medication. With topical creams also, there are a lot of restrictions. And topical creams do not cure it properly, completely. So they will just give temporarily. So if severe cases, we may have to give the oral medication. If very mild cases, we try to treat it with the help of topical medications only.
Right. And doctor, before we sum up the whole session, any take-home message for our viewers?
See, as like we have discussed, basically fungal infection is very common, and we can see many advertisement on the TV. Go for apply this cream, and you will get rid of the fungal infection in few days. Don't fall such traps. You have to consult a qualified dermatologist, because fungal infection is simple to treat, but if you are taking wrong medications, you can complicate it, and the treatment actually will increase in duration, and the patient may have to take higher medications if not treated properly.
Right. So please don't waste your energy, your time, your money, and most importantly, your health on over the counter medication or asking a friend or family or following an influencer. It can make your condition worsen. So please go and consult a qualified dermatologist at the very first place. Thank you so very much, Dr. Arti Bhasme. It was wonderful talking to you. Thank you for your valuable time and this very informative session. Thank you.
Thank you. Thank you. Same here.
And viewers, thank you for your excellent participation in today's session. For more information and updates on skin health and care, stay connected on our FB page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a great day ahead. Goodbye.